Mrs. Priscilla Eze is an outpatient who have come for a routine checkup. She complains that no doctor attended to her. After 2 hours, she arrived at the hospital.
I'm appealing to the doctors that God should touch their heart to come attend to the patients.
Just as in Kaduna, the Aminu Kano Teaching Hospital in Kano is unusually scanty following the doctor's strike. President of the Resident Doctors Association in Kano expresses displeasure at the back-and-forth meetings with the federal government without clear solutions.
We are calling on the religious leaders, on traditional rulers, on political leaders, and well-meaning Nigerians to actually press on the federal government to do the needful so that we can go back to work. We love our work. We are trying to do this job, and that's what we know how to do better, and we want to do it.
The concerns of patients is that they are at the mercy of the doctors. They wonder why the issue of healthcare, which deals with human lives, is not a priority for the government.
As a patient, I can't feel better because if the resident doctors are around, I know there must be a patient service to the patients. But for now, even me that I'm on my bed now, I am not happy at all.
The doctors now, they say that they will not come and check our patient because they are on strike, and this is not good. Yes, and we are appealing to the government to do something so that they will resume back to their work normal.
For my own case, I thank God I'm getting better, but for other patients, they are in pain, and that strike will not help. A lot of patients will lose their life because of this strike. So I will please the government to try and do something.
At the National Hospital in the capital city of Nigeria, Abuja, services to patients is opened amidst the strike. The Director of Public Affairs, Dr. Tayo Hastrop, maintains that the hospital had fully prepared for the outcome of the ugly side of the doctor's strike.
But for now, they've not have any meeting with the management for now, and I'm sure maybe by the end of today or tomorrow morning, they might go in full force to join the strike. And it's good to note that it's only resident doctors that are ongoing on these strikes. Don't forget, the consultants are on ground working.
In the southwest, resident doctors at the Federal Medical Center, Owo, lament the rot in the healthcare system in the nation, stating that the collapse is having adverse effect on both the health workers and the populace. They insist the management of the hospital is holding on to the 280 million naira meant for the payment of salary shortfall for the resident doctors since 2016 till date.
It's necessary that this strike has to go on because the health system in Nigeria is collapsing and it's affecting everybody. The doctors, the populace of Nigeria. It's affecting all of us. We need a better, or we want a better healthcare delivery for members of public. We want a better and conducive environment for us to practice, for us to discharge our duty adequately and appropriately.
At the Federal Teaching Hospital, Ido-Ekiti, Ekiti State, also in the southwest, patients are turned back as no doctors are on ground to attend to them.
Well, it's mean the ongoing strike is a very bad thing because so many sick patients are in hospital bed, occupying the hospital bed, without even attending to them. They will have to pay. Either they will attend you to or not, they will pay. So I'm just urging the federal government to make things quickly. They should arrange maybe anything, the meeting they want to do with the doctors, they should make it snappy so that the sick people, the patients, won't be another thing to cause entirely.
Augustine Ibikunle is the president of the Association of Resident Doctors, Federal Teaching Hospital, Ido-Ekiti. He and his colleagues want the federal government to adhere to their demands.
What we are requesting for is what we deserve, it's our right. We are justified to go on this strike. They are the basic things that are our entitlement. So naturally, we expect the federal government to do the needful and ensure that what we observe, what we see as a nation is the change that they promise us. And it's quite unfortunate that the leadership of this country at this moment has refused to improve on the health sector. And that is evidenced by the way the president of the Federal Republic of Nigeria has been junketing outside the country at each any particular opportunity to access health care outside the country, whereas we have enough manpower, we have enough resources in this country. What is needed is just an improvement on the structure and the at least acquisition of the necessary equipment.
It looks better at the University of Uyo Teaching Hospital in Akwa Ibom State, even though the resident doctors have joined the strike. The hospital management has put measures in place to ensure that the effect of the strike is not hard on patients. At the Accident and Emergency Response Unit and Dialysis Unit, consultants are seen taking care of patients, while the outpatient unit is also busy.
Resident doctors here have also joined the strike alongside their colleagues nationwide. But we are doing our best to still maintain medical services within the hospital. We've been able to mobilize all the consultants, and the medical officers, the youth corps doctors, and of course with the health officers, because with the directives of the Medical and Dental Council of Nigeria, and that they should not join the strike, they should continue with their training and posting. We've been able to put everybody and see how we can continue with the services in the institution.